Hey everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Knee to Know Show, we're going to talk about why do you have so much pain at night and what are the 4 things that you can do to help manage this pain and sleep better. Everyone, so today we're talking about why do you have so much pain in your knee at night? And we're talking about after knee replacement surgery, you're recovering from surgery. Why is the pain so bad at night? And, there's probably a combination of reasons, and I probably can't give you one specific cause or why specifically what is going on and what is causing that pain and why is it so intense at night. But I do have my idea and my thought about why this is. And the reason I think it is because when you are in bed at night or a recliner or wherever you like to sleep and you are trying to fall asleep at night, you have no other distractions that you can possibly think of. So you're just laying there with your thoughts and you're just trying to fall asleep. And the only thing that's in your head is the pain, the discomfort, and the stiffness that you're experiencing in your knee, and how that pain, discomfort, stiffness, irritability, restless legs is preventing you from being able to fall asleep, and how frustrating and angering that is. And so compare that to during your day, you probably have similar levels of pain throughout the day. You have pain when you're walking, when you're doing things, but you're distracted. You're distracted by doing the activities and the things that you do throughout the day. You're distracted by, if you're just resting and sitting there, you're distracted by the TV's on, or you're on the computer or on your phone. You're distracted, you're reading a book maybe. You're talking with a friend or you're talking with a family member. Something else is going on. And then when you're up and about and doing things, you're not thinking about that pain, or you're thinking about that pain, but you're also thinking about that thing you're doing. So if you're walking, you're thinking about walking. If you're at a physical therapy session, you're thinking about doing the physical therapy and the activities and the exercises. If you're preparing a meal, you're thinking about that task and what you have to do for that. All the time throughout your day, even though you have this pain, most likely still, it's not the one and only thing that's on your mind and the one and only thing that you're thinking about. It might be high priority, it might be really high up in your mind, but it's not the one thing. You're at least distracted to some degree. When you're trying to fall asleep at night, unfortunately, you're there, it's you, your thoughts, and this thing that is preventing you from falling asleep, and how significant and frustrating and anxiety provoking this is. So that's my theory. That's why I think, at night it seems that way, that it's such an intense increased pain and discomfort, when really it probably is at the similar level, but now it's that one thing on your mind and you don't have any distractions keeping you from thinking about that. I'd love to hear your feedback. If you have any thoughts on that, if you agree, disagree, I'd love to hear it. But let's talk about, more importantly, what can we do to manage this? What can we do to help this pain, help this discomfort, and help you fall asleep at night? And these are probably my 4 biggest things that I have for helping someone who has this pain at night that's preventing them from sleeping. It's helping, causing you to be frustrated, anxious, and just fatigued and tired and exhausted. And it's just a really horrible and awful thing, and a lot of people complain about it after knee replacement surgery. So my first thing that I think is most important is, one, just accepting the nature of the situation, accepting the nature of the beast, so to speak. A lot of people, vast majority of people after knee replacement surgery, you're going to have some degree of difficulty with sleeping. You've had a knee replacement, it's a major surgery, you're going to have pain, you're going to have discomfort, you're going to have difficulty finding a comfortable position. It's just the nature of the situation. And what happens is, if we have this pain and discomfort and everything and trouble sleeping, if we get frustrated and we get really anxious and we get worked up about it and we get angry, those emotions and those feelings are just going to feed into this difficulty sleeping more and more. The more you get anxious, the more you get frustrated, the more you get angry, it's just going to make it more and more difficult for you to actually fall asleep and get a little bit of rest and comfort. The more you get stressed out about it, you have to be able to say, look, this stinks, this is awful, I really can't fall asleep. But I'm also going to just accept that, this is normal. This is okay. This is something that almost everyone after knee replacement surgery goes through. And over time, with patience, hopefully, probably not as quick as we'd like to, but over time, over days, over weeks, it's going to get better. It's going to get easier to fall asleep. I'm going to get eventually, over time, back into my routine. It might take longer for some than it does for others, but for the vast majority of people, you're going to get back to being able to go to sleep effectively and okay. So first thing, accepting that this is just the nature of the situation, and I'm going to do the best I can to manage it, to improve my ability to fall asleep and to be comfortable, but it's just the nature of what it is right now, and I understand that, and I know that it's going to get better. That's thing number one. Number two is, let's just think about, do I have good sleep habits in general? It's already tough enough to try to fall asleep with this extreme knee pain. We don't need to be adding things that are going to make it difficult for you to fall asleep. So these are just common things. Are you trying to limit your screen time and limit that LED light and that light that's getting to your eyes during the night, that blue light? Are you trying to limit that prior to going to bed? Are you trying to maintain a good sleep cycle? Are you waking up at the same time? Are you going to bed at approximately the same time every night? Are you have good sleep environment? Do you have almost completely black if you possibly can? Do you have limited to no noise or no noise at all? Or maybe just some white noise? Do you have it at a good room temperature that you're sleeping in? Do you have it around, that sweet spot is probably about 60 something degrees, 66, 67 is what I hear a lot, is that kind of best room temperature. That's 66, 67 degrees Fahrenheit. So do I have a good environment for sleeping? Do I have things that I'm not, looking at my phone or looking at work emails right before going to bed? So good sleep hygiene, good sleep habits is very important, because you already have enough trouble with having extreme knee pain, having the stiffness, having the discomfort in your knee. Don't compound that by having poor sleep habits. Are you not drinking caffeine in the afternoons or late in the evenings? Are you trying to limit your use and limit drinking alcohol as well? That can impact your sleep and the quality of your sleep. So that's number two, just having good general sleep health. Number three is, what are you doing prior to going to bed? So probably the best advice and the best help I can give you for someone who has pain and discomfort is preparing about 45 minutes, about an hour before going to bed, doing certain things to really try to reduce your symptoms, reduce your pain as much as possible, so that you have a level of comfort and a level of relaxation that you can at least fall asleep. That comfort might not last. You might wake up every 2 hours, or it might be really tough to stay asleep, but at least you're decreasing the stress, decreasing the pain as much as you possibly can, that at least you can fall asleep within a reasonable time. So what does this look like? Well, it means pain medicine. Are you taking your pain medicine an hour or 45 minutes before going to bed, or some other combination of whatever it may be? If it's prescription medicine, if it's over-the-counter, Tylenol, something like that, are you taking that medicine that is prescribed and recommended by your doctor, your surgeon, prior to going to bed? Are you using other strategies to manage your pain and manage your stiffness and tightness and discomfort? That might be icing. That might be using moist heat or heat, some sort of heating device. It might be some gentle massage. So using a therapy stick, using a lacrosse ball, using just your hands, a foam roller, and just massaging out the muscles around your knee joint, in your quadriceps of your thigh, in your calf, massaging out those muscles, improving some of that comfort, decreasing some of that stiffness and tightness and pain. It may be just some gentle rubbing with your hand to try to decrease that discomfort. Or it might be things like stretching and moving. So some gentle stretches, some gentle range of motion, some therapy exercises that you've been given as well. Doing these things, trying to limit your pain, trying to decrease your symptoms as much as possible prior to going to bed so it's easier for you to fall asleep. Then the last thing I want to say is, how are you positioning yourself in bed? Are you trying to find a position that is comfortable? So big takeaways with this: pillows. Use pillows. Elevate that leg. Get it up nice and high if you're laying on your back. If you're laying on your side, put those pillows between your legs. Improve that alignment and positioning of your pelvis and your hips, and improve your comfort and decrease some of that stress through the knee. Just use pillows and guess and check and play around with it and find what works well for you and what is comfortable for you. Other things, you can use a bolster, you can use a full body pillow. You may even end up sleeping in the recliner a little bit early on after surgery. Whatever works for you and helps you to fall asleep in a comfortable position, that's beneficial. So again, positioning and finding a good position, utilizing pillows, utilizing what position you lay in, things like that. So those are my 4 takeaways. So 1, just accept the nature of the beast. Come at peace with, this is going to be difficult. I'm going to have some issues, but eventually it will improve and get better slowly over time. Number 2, am I preparing myself for falling asleep? Am I doing the right things to decrease my pain, decrease my symptoms, so that I'm able to be comfortable and fall asleep, hopefully in a good timeline? Am I just practicing good sleep habits and good sleep health in general? Things like when I go to bed, when I wake up, the environment of where I'm sleeping, am I limiting screen time, not looking at stressful things and stressful emails right before going to bed or whatever that may be. And the last thing, of course, is what is my positioning? Am I finding a position that is comfortable? Am I playing around with different positions, using pillows, using whatever it may be to find what is comfortable and effective for me? So that's my advice for all of you. Again, it's the nature of the beast. This can, be a really common problem, but it's not something that's unheard of, not something that's strange, not something that's bad. It's just something that happens and you have to deal with it. And then as your body heals and recovers, it'll be easier and easier and less of a problem and less of a difficulty. Thank you very much for watching, everyone. As always, please subscribe. I post videos regularly on everything related to knee replacement, recovery, preparation, the surgery itself. As always, leave your comments, leave your questions. I do my best to get back to everyone that I see. Have a great rest of your day, everyone, and take care.